Which hand do we need to examine when we do blood pressure examination? Incorrect. Incorrect. Both hands. If you see patient first time, you need to examine two hands of patient. Sit down, please. We will examine only one hand, but in real practical case, you need to examine both hands. Why?
To compare the reading. That's
So, if BP is different, which blood pressure we will use for final conclusion?
non-dominant.
Higher blood pressure we will use for conclusion. We don't know, some patients can have features. Paralysis. If one hand is paralyzed, BP will be much more lower in this hand than in another one. Also, patient can have coarctation of aorta. Coarctation of aorta is narrowing of aorta. Narrowing of aorta can be in ascending path. It will look like a stenosis of the aorta. Coarctation of the aorta can be between brachiocephalic artery and left carotid and subclavian artery. If narrowing will be here, this hand will have very big pressure, this hand will have low pressure. To find these conditions, we need to check BP on both hands. Also, coarctation of aorta can be in this place. In this case, lower part of patient will look atrophic. Higher part of patient will look hypertrophic. In this case, also we need to measure blood pressure on the legs. So, we need to examine two hands. What are the rules of doing it? How patient should sit?
Do not cross legs. Relax.
Okay, relax. Okay. Should not smoke how long?
30 minutes.
At least 30 minutes, better 1 hour. What about coffee, tea?
Smoking.
Should not drink coffee, tea, smoking about 1 hour before examination. Physical exercises?
No.
How long?
15.
1 hour.
30.
At least 10-15 minutes without physical exercises.
Shut up. You smoked.
I didn't have cash.
When we dress our equipment, our tonometer, we need to close manjet, and when we close it, we need to be able to put two fingers under the manjet. Manjet have to be placed 2 fingers higher than elbow area. Patient have not to put his hand like this. In this case, we need to find artery, shoulder artery in another place. So, more comfortable for us if it is possible for patient to put hand like this. These tubes should not be crossed. It could be from the lateral or medial side. It doesn't matter.
Doctor, we always thought it should be on the medial side.
Yeah, there are rules about medial side. In real practice, it doesn't matter. Why medial side? Because of pillow is here. When we will pump air, pillow will enlarge in this place. That's why this pillow will compress arteries first of all, but this side will be compressed too. That's why it's not so important. Main rule, do not cross these tubes. If they will be crossed, we can hear extra noises. This device, tonometer, have to be in level of the heart. Level of the heart is level of the manjet. So this level is level of heart. We can put it on the table. It will be a little bit lower, not very good. That's why we can use these hooks to place it on the manjet. It is if to do everything correct. In real practice, sometimes you will do this examination incorrect, but these rules do not affect results a lot. Next, stethoscope. Place for stethoscope is medial side of elbow area. Place is here. How many millimeters do we need to pump?
140.
Incorrect.
Based on the person.
What do you mean?
Unless we don't hear the sound.
Until sounds will disappear in stethoscope, or we can check it using pulse until pulse will disappear. After this, we need to add 20 millimeters. After this, we need to release air. When we turn right, manjet is closed. We can pump air to the manjet. When we need to release air, we need to slightly open this device. If we will open a lot, air will be removed very fast and we will not hear anything. That's why we need to do it very, very slightly. Next, we need to look at tonometer and auscultate heartbeat, pulse beats. When first beat will appear, it is systolic pressure. We need to check number. When beats will disappear, it is diastolic one. We can do it without stethoscope, we can check only pulse. When first beat will appear, it is systolic blood pressure, but diastolic one is impossible to measure using pulse. Pulse disappeared and release air. First beat was 123 and last beat was 93. 93 is too much.
Doctor, that thing doesn't work. Like, it shakes. Like when it gets to.
Yes, but it's not always equal to real BP. You start here beat, and in this time arrow start move, start jump. So, but it's not true. It's not always work well. So if somebody want to try.
Okay.